Thank you, Mr. Speaker. Let me start by reading some quotes with regards to safe supply and the diversion into criminals' hands. March 12th of 2024, the government House Leader said that widespread diversion was, quote, simply not true. February of this year, Mr. Speaker, the Premier questioned this, saying, quote, if it is happening. February of 2024, the Provincial Health Officer said, quote, diversion is not in itself good or bad, or right or wrong, end quote. The government's own leaked report has shown that this information, that these statements are false. Will the Premier stop gaslighting the public? Will he admit his government has been misleading the public on this? And will he enact a public inquiry into the safe supply scandal?
Honourable Premier.
We've lost 16,000 people in this province to the toxic drug crisis since it was declared. It's fathers and mothers and sisters and brothers, colleagues, friends. And the consistent message that has come to us from people who've lost loved ones is do whatever you can to try to help keep people alive, get them into treatment so they can rebuild their lives. And it's advice from family and friends like that that resulted in the prescribed alternative program to get a nurse or a doctor between someone struggling with addiction and a predatory drug dealer. We know it saved lives. We know it stabilized lives. The Conservatives know that too. And their spokesperson has supported the program in principle. But that doesn't mean that we tolerate diversion. We have taken steps with police. This is how the opposition knows about the issue with these pharmacies, to investigate bad pharmacies, to ensure that that information is shared with police for prosecutions, to address issues of diversion. Now the Health Minister has made an important but difficult announcement to move to an exclusively witnessed program, which we know is going to make it harder for some people to access this program that we know could save lives, but which we have to do to address the issue of diversion.
Leader of the Official Opposition, supplemental.
Mr. Speaker, it's true that 16,328 people have lost their lives to overdose. That's true. But it's also true that the Safe Supply program has put 22,416,000 doses into British Columbia and an unknown number of those into the hands of criminal activity. The report by this government shows that that is the facts. These drugs, of course, are also not safe. They are actually very dangerous drugs as well. The report clearly shows that this has been going on for years. The police reports have shown that this diverted supply into the hands of criminals has been going on for years. And yet, as given those quotes, this has been denied by this government. The real question that the public is asking is who knew in advance how bad this situation was? When did they know about it? And quite frankly, the taxpayers want to know how much their money was wasted on drugs getting into criminals' hands. This is why, Mr. Speaker, the Premier must call a public inquiry and get answers to the public that demand to know how this government has been mistreating this file.
Premier.
Honourable Speaker, the risk of pharmacies diverting opioids existed before the prescribed alternative program. It exists after. The entity within the Ministry of Health that was set up.
Members, Premier has the floor.
The entity within the Ministry of Health that was set up to investigate pharmacies was set up in 2014 by the BC Liberal government because of issues related to the diversion of opioids. And so ensuring that that agency had the authority, was focusing on pharmacies and the issue and the risk of diversion was a priority for us. We ensured that they had the resources to do that. It resulted in a very significant investigation, which they were briefing police on. That's how the opposition knows about this. It has resulted in criminal investigations that are ongoing with the College of Pharmacy to shut down bad actors, and the unfortunate and difficult but necessary decision to move to a witnessed-only program, which we know will compromise the access of people who need this program to stay alive, but we have to do to ensure that we're addressing the risk of diversion.
Member for Surrey Cloverdale.
Mr. Speaker, the Premier and his government want you to believe that this is a problem with bad pharmacies, that it's bad actors. But this isn't a problem with bad pharmacies. This is a problem with bad policy, and the bad actors are members of this government and bureaucrats working under the supervision of this Premier who have been gaslighting British Columbians for more than 2 years. Mr. Speaker, after years of downplaying and denying the significant diversion of so-called safe supply, the government's own leaked presentation reports that their publicly funded drug trafficking is widespread. Taxpayer-funded safe supply went from prescribing 577,000 pills in 2020 to more than 22 million pills and fentanyl patches in the last 2 years. Wow. This is increasing the risk of population-level harms, with unknown quantities, Mr. Speaker, being trafficked provincially, nationally, and internationally. The public has a right to know, how could this happen? Now that the Premier recognizes his experiment has failed, when will he call a public inquiry?
Mr. Premier.
Thank you, Honourable Speaker. I think it's important to be clear. I canvassed this with the member for Surrey Cloverdale extensively in the estimates debates before the election. I acknowledge the risk of diversion is a serious issue. We were taking steps to ensure diversion, if it was taking place, was being addressed, resulted in dedicating a team within the Ministry of Health to investigate pharmacies, which is what the opposition has become aware of. It's led to criminal investigations. It is a serious matter. But on the issue of prescribed alternatives, I won't let the member shrink from her own record, because it's important to recognize that there's not a division in this House about the need for this program. February 17th on CKNW, the member said, "Conservatives, we know that there's a role for these drugs to be used to help people, to be titrated to other medications, to stabilize people." Well, I agree entirely. The unfortunate thing is some people are going to lose access to this program because of a difficult decision to move to witnessed ingestion only. And that's an unfortunate thing, but it's a necessary thing to address the issue of diversion.
Surrey Cloverdale, supplemental.
Mr. Speaker, more gaslighting from a Premier who fails to recognize his own failed experiment. For sure, there is a role for prescribed alternatives for drugs to help titrate and stabilize, but we're talking about a government program that has dumped millions of pills into the hands of criminals and drug traffickers, and I first raised the issue of diversion in this chamber on February 9th, 2023. That's more than 2 years ago. 2 years of flooding this province with hydromorphone, a highly addictive opioid 5 times more powerful than morphine. 2 years of fueling the fentanyl trade with program participants trading their dillies for street drugs. 2 years of taxpayer dollars being used to enrich criminal organizations, putting money into the hands of drug dealers that have killed 49,000 Canadians. Mr. Speaker, British Columbians have the right to know, how did this happen? When will the Premier call for a public inquiry?
Premier.
I'm sure the member didn't do it intentionally, Honourable Speaker, but she conflated the toxic street drugs like fentanyl and carfentanil with the prescribed alternative program supervised by nurses and doctors. We've lost more than 16,000 people to the toxic drug crisis, and the prescribed alternative program, what I understood the member previously supported when she said the government has introduced a safe supply where they're giving hydromorphone and other drugs, slow-release morphine, they give it to individuals to help them get off illicit drugs, and that we need to continue exploring. Or when she said, this government was said to be exploring options for pharmaceutical alternatives to illicit drugs, and that's what they should be doing. That's October 26th, 2023. As recently as February, supported the program. It's an important program to save lives, but that doesn't mean that we tolerate.
Premier will continue.
Doesn't mean that we tolerate diversion. And to prevent diversion, we have to take the unfortunate but necessary step of moving to a witness-only.
Members. Premier.
Moving to a witness-only program, which will restrict access to the program for some people who are struggling with addiction, especially in rural areas. But we have to take that step in order to ensure that the public is protected. And we'll continue to support the ongoing police investigation, the college investigation into these pharmacies as best we can.